You're asking me to make a 30-year history in, I don't know, how many minutes do I have?
Between about 10 to 15.
About 10 minutes,
Yeah.
okay. But, you said knowledge. We need to empower our health professionals. And yes, I would say knowledge. My first theme really is knowledge is power. The first thing we need is really exposure of our health professionals. And that's exactly what happened to me. Um, I, I was always a gender activist, having stopped the child marriage at the age of 15. That's not easy. Anyway, but that's a different story. However, I continued being involved in gender issues until um, HIV and AIDS hit in Botswana. And this was in 1985. And being a gender activist, I knew that this was going to affect women more than males. So I used my knowledge power, and I was already doing research to really influence others. The first thing that we did, you know, uh, exposure of health personnel was to actually change our nursing and medical curriculum to integrate HIV issues into the curriculum. As I'm going to be telling you some of these things, I may sound like it was easy. It wasn't. It actually needs a bold leader where sometimes you are frank to the point of being rude. And that's really the thing that carried me through all the way. Even as a minister, I had to deal with other ministers. And when we're talking about key populations, it was not easy. But at least in terms of health personnel, one of the things we had to do in changing our curriculum, I know those of you who did medicine, MSM or homosexuality was put under abnormal psychology. That's right. So the first thing we did was I influenced to get that to be taken out and just under the name sexuality. Amen. It wasn't easy, but we did end up not having abnormal, under abnormal psychology. And we made sure that we had sex workers coming and doing lectures on their experiences, on what they expect from health personnel, sex workers, MSM. And this time, you know how, in our African situation, sometimes the first MSM to come out were foreigners. We wanted a Botswana. Because sometimes it's like, no, it's a foreigner. It doesn't happen here. In Botswana, we used in Botswana to come and lecture to students, medical students and nursing students, to say, this is me. And this was like in the early 80s, right? We knew that these were illegal. She said, well, illegal, the act, but the person, fine. So that even when students say, but isn't that supposedly illegal? We said, no, the act. Here you have a sex worker who is telling you of her experiences and how she expects healthcare workers to be able to work with her in that. So that helped a lot. We exposed quite a number of our own health personnel to that. And it helped me because as a professor later, I actually made sure that the students did research on HIV and AIDS. And these later, when I became a minister, I wanted a health coordinator in each and every ministry, not just the Minister of Health. And guess what? All the coordinators were my former students because they had master's degrees and they had done research on HIV. That helped me a lot. Yeah. But the point is, when I then, because of my advocacy, and I think it was also to shut me up, yes, I became a Minister of Health. But I'll tell you, as part of, I also had a prisoners to come and lecture to my students. Why? Because sex occurs in prison. And I knew there was no way we were going to put condoms in prison, right? So what we used to do, as a community health care, we'd smuggle condoms into prisons. And when I became a minister, I thought, now I have the power. I'm going to now legislate. We're going to have condoms in prison. And hey, it was not easy. The very first memo that I put in front of cabinet, with a president who was so well convinced on HIV and really knew that HIV was a problem in Botswana, and actually had put, at that time the African presidents had said they would put 15% of their budget to health and AIDS. When he asked me if I could be Minister of Health, I told him I want 15%, because at that time it was like 9. A lot of them had not reached that. So I said, only if you give me 15% to health. And he said, I'm giving you 20. So I had 20% of the budget, for health and HIV. And therefore I thought, okay, first thing, condoms in prison. He gets there, and my own colleagues would not want to hear any of that. I was even quoted the Roman Dutch law and all that. And this is, the importance here is really to show also the exposure exposure of our own legislators. Half the time we vote them in, and we think just because we voted him, they're okay. No, I think in their orientation, they need, all the exposure they can get. Gender issues, sexuality, everything, AIDS, HIV and AIDS. But then we can have good legislatures. Right now in Botswana, one of the things I was able to influence, because we just had an election, I said to the president, in the orientation of members of parliament, we went in the gender issues, human rights issues, everything on HIV and AIDS. And it was a by the way, because they had not even put that. They were on fiscal issues that are affecting Botswana, development issues, nothing on HIV. So it was only then, no, it's got to go in. You see? So that as advocates, we need to always be in touch of what's happening. So that at least now we know we have legislators who are well savvy with such issues. So anyway, but I want to tell you that thing did not go. My own colleagues were saying to me, no way. No, those people are not supposed to be having sex. And I had evidence. Who had said evidence? Was it you, Linda? That, that evidence, we need to, evidence is great. It hits you in the face and you really cannot shy away from it. I had evidence that people got into prison uninfected and they came out infected. Also? But none of the ministers wanted to hear that. And Botswana is a real democracy where when you are presenting a memorandum, the president keeps quiet. He listened to what people say, and then in the ultimate, he's like, okay, I've listened to all of you. This is the way we're going to do it. So he listens to all these people. Despite his conviction, he looks at me and he says, Minister, maybe the time is not yet ripe. I think you should just continue getting condoms into prison, But I'm saying, really? You mean I should smuggle condoms again? Yeah. So I continued smuggling condoms. It was only recently, about a few years ago, that condoms were now allowed into prison. So what it's really saying is that we as young people, you need to be advocates. We need leaders who can go from political will, commitment, and rhetoric to concrete actions. That's what's missing when it comes to MSM and whatever. Even sex workers. That we are all aware that sex workers are there. Our leaders, will agree on that. But it's more like, but they are illegal. And we say, no, but guess what the infection rate is among them? So we need to protect them. We need to protect the population. So it's really saying to presidents, now when I was regional director, I had to now take what I learned in Botswana to the region. And now it was working with presidents. Let me tell you my conversation with one president. They had deregistered an organization, and I needed them registered so that we can assist them with funding, so that they can, this was an MSM, a gay men and MSM organization. And this president says, Professor, God did not create Adam and Steve. He created Adam and Eve. So I said, very well, Your Excellency, but guess what? Steve is here. And he is your child, yours and mine. he needs to have the same access to services as Adam and Eve. I said, and not only that, I'm speaking as an African mother who has children in the whole continent, and some of them are Steve's. I want Stephen to have the same rights as Adam and Eve. Is that too hard for you to understand? I had to look at him like in the eye, and he said, well, yeah. You are coming from an African mother, I can understand. But the Western world, they're trying to shove it down our throats. They said, no, they're doing so only because you and now are not doing enough. If we can register and have people have access, no Western person is going to tell us what to do. So let's go ahead. So that's the kind of advocacy. And the great part is that I have come. You also need to be coming when you are doing that with some degree of authenticity, in the sense that, as the gentleman said, in Botswana, but I had 20% of the budget. I was able to use civil society to actually, within 4 years, we managed to have 80% of the people who needed ARVs on ARVs within 4 years. And within 4 years, we brought down mother-to-child transmission from around 28% to 8%. So Botswana is now under 1%, but it's, but it meant working hard, and really, so I think I'll answer questions later, but, so thank you very much.